Before we begin, we'd like to give special thanks to all of our sponsors for helping make this event possible each year. Specifically, thank you to CRL FormFox for being our title sponsor for 5 consecutive years. And thank you to our platinum sponsors, AAOHN Technologies, Psychmedics, Samba Safety, UKG, and Quest Diagnostics. Hi, and thank you so much for joining us for another session of Day with DISA. Today, we're talking about workplace violence and occupational health. We're joined by Kim Olszewski, the president of the AAOHN, the American Association of Occupational Health Nurses, and director of Client and Medical Provider Services at DISA. Kim, how are you doing today?
Doing great, Thomas. Thank you.
Awesome. Well, before we jump into the presentation, I do want to remind everyone that if they have any questions, use the Q&A button at the bottom right of the player. Any questions we're unable to answer today, we will reach back out to you after Day with DISA. Additionally, we'll make a copy of this presentation available for download on the Materials tab at the end of this session. With that being said, Kim, the floor is yours.
Thank you. Hi, everybody. As Thomas mentioned, I'll be doing a brief update today on occupational health and what's going on in the industry, and then really kind of hone in on workplace and employee violence as a topic for this afternoon. Again, this is my brief bio that Thomas just mentioned, and I'll have my contact information on the last slide. The objectives for about the next 50 minutes to an hour is to do a brief occupational health update and looking at the 2023 priorities, looking at statistics and current trends related to workplace violence, discuss strategies to identify and eliminate workplace violence in the healthcare setting, identify potential workplace violence situations, and review best practices for development of a workplace violence policy. So my occupational health update is actually pretty brief, and I honed in on what the 2023 initiatives were for 2 of the leading industries that we follow in occupational medicine, that being NIOSH, and also what the U.S. Surgeon General's priority areas are for this year. So there's a lot of information out there right now on social media with these initiatives. Specifically, the Surgeon General has a really nice presentation out there specifically on this topic. But first I want to talk about the NIOSH strategic goals. And their goals were actually set right before the pandemic, 2019 to 2026. And their focuses are to reduce occupational cancer, cardiovascular disease, adverse reproductive outcomes, and other chronic diseases, reduce occupational hearing loss, occupational immune, infectious, and dermal diseases, occupational musculoskeletal disorders, occupational respiratory disease, improving safety to reduce traumatic injuries in the workplace, and to promote safe and healthy work design and well-being. As I mentioned, the U.S. Surgeon General did a similar report looking specifically at 2023, and the initiatives are being placed heavily on workplace mental health and well-being initiatives. And NIOSH also has that same initiative. But when we look at the Surgeon General's priority areas, they really have 5 different essential areas that need to be focused on. And it's an opportunity for personal growth is what they're saying, mentoring at work, focusing on work-life harmony, work-life balance. We talk about that a lot. Our connection with community, and also protection from harm. And the protection from harm is what I'm going to focus on today as some initiatives and some examples and case studies and ideas that should hopefully probe some thoughts for you to take back into your workplace and your industry as you look at workplace violence, preventing it, looking at possible incidents that did happen, and how can you move forward with a good proactive plan to hopefully identify problems and mitigate those problems before they even occur. So let's start by looking at some definitions. And what is workplace violence? And, think about, as I'm going through these slides, what are some examples that possibly you have had that, kind of strikes with you as maybe this was a situation I should have intervened on sooner. Maybe this was a sign that there was a problem. So when we look at the definition, workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the work site. And these type of behaviors can range from threats, and it can also be verbal and physical assaults, and ultimately even potentially homicide. And I think we can all say, you know, we've watched the news and see what's going on, and a lot of these things are coming to the forefront as to there were signs ahead of time. Most recently, the Idaho college student murders, and some of the signs that maybe they're picking up on now of behaviors that may have happened that could have led to this. And lastly, workplace violence, it can affect and involve employees, their clients, their customers, and even their visitors into their facilities. So what are some of those characteristics to be on the lookout for? And if you see the little gauge there, low, middle, and high, some are maybe more subtle, some are maybe more obvious. But we look at, you know, some behaviors and situations that may lead to that problem. So think of the workplace bully. That person might be an intimidator. He might have bad behaviors, he or she, I shouldn't say he or she, may have those bad behaviors that no one wants to address. Just that person that does not seem happy, and again, is trying to be influential of others, maybe in a not so positive way. We have the disgruntled employee. That employee might have thought or maybe has been treated unfairly by the organization. They blame the system. They feel that it's somebody else's fault, and they want to get back at that person or the employer for that particular issue. It might be someone that's overly attached, and overly attached means perhaps they won't go away. Perhaps their job was eliminated or downsized. Perhaps they retired and are having a hard time losing their identity with that job, because that job is their identity. They may not have many friends or family. They may have little social life outside of work and consider work being their social life. And they may have been fired and feel betrayed, and now they don't know what to do or how to react to that. You might have that employee that has nothing left to lose, total distress. Maybe they're going through some kind of personal crisis, such as a divorce, or had a recent loss in their life. They feel that there's nothing left to lose should they do this particular act. Perhaps it's mental health issues that are treated ineffectively or not treated at all, or it could be substance abuse. So there's many things that can exhibit characteristics that can lead to a workplace violence situation. Okay, so statistically, when you look at the Bureau of Labor and Statistics, you know, you can see here that I cited from 2019, in the US, there was 761 cases of intentional injury by another person. And I did look up the most current statistics, and what I could find for 2020 was there were, now remember 2020 was at the height of the pandemic, with the height of COVID. So work as we knew it was a little bit different, or a lot different in most cases. But in 2020, there was 392 workplace homicides and 37,060 non-fatal injuries within the workforce. So if we break that down even further, what particular areas of the workforce seem to be most impacted by these statistics? And it's cited that sales, transportation, material moving, management, and also construction were the highest. And actually, sales accounted for 23.5% of all workplace homicides. So as I move through these, you know, next couple of slides, and we spend the next hour together, think about, you know, kind of some of these triggers and some of these ways that we can cut back on this statistic and focus not only in sales, but again, in any sector of industry. So some of you may know that I also teach, so I like to put in exams and ways of, you know, kind of polling my participants and getting feedback on what they know as a baseline. So these are some true and false statements, and just think about, as I move through them, how you would answer. Okay, so the first one is, workplace violence causes businesses to lose $250 to $330 billion on an average year. So true or false? Do you think that's true or false? Well, that particular question is true. And according to Forbes company, losses due to lawsuits, injuries, decreased productivity, and even due to damaged reputation of the company, as well as loss of customer base, severely impacts a business when a workplace violence issue does occur. The next question, approximately 1.5 million workplace assaults occur every year. That also is true. In fact, many go unreported. And, we look at homicides, aggravated assaults, robberies, and there's things that happen that for fear of retaliation or some other consequences, they do not even get reported. So again, think about that number, 1.5 million in the workplace. Number 3, 24% of employees are aware of workplace violence incidents in their organizations. And I want to point out that this survey was actually taken from SHRM, which is the Society for Human Resource Management, which, by the way, is one of the key places I went to for information for this presentation, because they do an outstanding job of providing resources and tools to implement in the workplace. But for number 3 there, SHRM actually did a survey on workplace violence, and it said at least 25% of employees are aware that a workplace violence incident has occurred. And surprisingly, 19% were unsure. And I'm going to say that statistic is probably due to they're not sure what workplace violence is by definition and may have experienced it and not even know it. And 14% actually said an event occurred and they're aware of it. All right, number 4, workplace violence statistics show that 251 fatal work injuries happen due to violence. That also is true. We just went over the statistics. Usually the fatalities are as a result of some type of violent type interaction. And also they cited in this particular rationale for this answer is it's most common to 55 and older. And I thought that was an interesting statistic. I would have guessed that number being lower, but they cited 55 years of age and older. All right, number 4, 45% of American workers are aware that workplace violence prevention programs exist at their companies. SHRM, again, the Human Resource Management Society, 71%, they are told that they know what to do should an incident occurs. And half of them feel that more training is needed. So they are aware of what the situations are, but they do feel that more training and resources need to be available. And finally, the last one, 41% of registered nurses are victims of bullying, incivility, and other acts of workplace violence. That is absolutely true. There's many areas in healthcare, healthcare being one of the leading indicators of jobs that workplace violence does occur. And we saw a huge increase from what I'm hearing anecdotally and from a qualitative perspective from nurses, that through the pandemic, that has even heightened due to the stress of increased hours, low staffing, the compassion fatigue, what have you. And the statistics show that it's a high area for workplace violence issues. So who's most likely to be a victim of workplace violence? And I just gave you a couple examples throughout the previous couple slides. From a job category, as I mentioned, sales, that's one of the high ones, healthcare being another. And healthcare is a major concern because of medications. Healthcare workers are aligned with being accessible to medications, as well as veterinary clinics. Medications are available there. So those are 2 high-risk job groups. Corrections, police officers, correctional officers, teachers, municipal inspectors, retail, those that sell alcohol, and mass transit, such as taxi drivers, bus drivers. They are all high risk, and also people that work in banks or financial institutions. Excuse me. Job locations. Obviously, working in the public puts you at a heightened risk. Working alone puts you at a heightened risk because you do not have people around you to be supportive. Those that handle money, that's another concern. Mass transit, as I just mentioned. Community-based committees organizations, community-based settings. Over the wintertime, we recognized that during a holiday parade, there was a shooting at a community-based event. Again, another situation where there was a gathering of people. And during some type of organizational change, such as a strike of the workforce. So some times of the year that we see most kind of high prevalence for workplace violence is late hours. Interestingly enough, through tax return season and when there's financial things that are involved. Holidays, paydays, perhaps the payday you did not get compensated appropriately, or there was some error on your paycheck and that led to some type of violence. Report cards for students. Performance appraisal time. That's another when maybe employees feel that they were not evaluated appropriately. Car repossessions, overdue utility bills, and overdue and cutting off of utilities is another high risk situation. So I know you get a copy of these slides, but this particular slide, and there's a couple others in here that came from the U.S. Department of Homeland Security, which is an absolutely great resource as well as you look at implementing additional workplace violence type activities. So again, we've been talking a lot so far, and you've kind of picked up on some of the indicators that an employee may be subject to a violent type behavior. And it's not that employees, and they stress in this, they don't just snap. Some do. Some have that breaking point and they just snap. But there might be those, kind of precursor type situations that you may see this coming on, such as increased, maybe you work beside someone or you're very familiar with someone that shows, behaviors that just are not typical for them. Increased alcohol and illegal drug use. Perhaps they've had increased absenteeism. Their appearance and their hygiene may have taken a drastic change, maybe look more unkempt, maybe not dressing appropriately for the weather or for the situation. Mood swings, repeatedly stating that they're not supportive of company policy or they're not happy with company policy, or they might just feel that sense of paranoia. And there's a bunch here on this list and you can look through. But I'm sure some of these behaviors resonate with you as to some typical kind of lead-in or, kind of precepting, I guess, to a situation. So just a couple more terminology, and I started out with that slide on terminology, but just as we move through these next couple of slides, so when we look at workplace violence, again, it could be an act, it could be a threat, it could be an intimidation, it could be a behavior. So, from a workplace violence, we see, as I mentioned, like school shootings. It could be an incident that happened, over the holiday season in sales when they went into a store. So those are issues of workplace violence. Now, bullying is usually done by peers and subordinates, and it's a pattern of mistreatment. It can be physical or it can be emotional. And it might be something like leaving intimidating notes, calling people out during a meeting, just behavior that is not typical and expected in a professional manner. Real close to that term is incivility. And it's deviant work behavior. They're rude, they're discourteous, they're impolite. It could be a group of people. I mentioned nursing in particular is a high area for workplace violence and, incivility. And there's a lot of focus and research being done on that, especially coming out of the pandemic. Next, we have cyberbullying. That could be those emails. It could be something in social media, something that's attackful. During our last presidential election, and we saw all those political emails and all that going forward, that was intimidating. And that was cyberbullying, if you will, because it was unsolicited comments on a particular issue. We have mobbing. Mobbing is when it's done by a group of individuals. It's usually physical. We think about mobbing when they were crashing into store windows and forcefully entering and stealing product. We saw a lot of that there for a while during the pandemic, and that was called mobbing. And then lastly, we have lateral violence, and that can be hate crimes that can be organized and certainly harmful to the workplace. So as we look at NIOSH now, we're going to shift gears. We went from Homeland Security. Now we're going to talk to NIOSH. And NIOSH actually has types of workplace violence. And you can read through the definitions here, but one is with a criminal intent. So as I just mentioned, perhaps it is those store robberies that were occurring during the pandemic. There's a crime in conjunction with that robbery, or the violence. So it's like a robbery, shoplifting, trespassing. It could be customer client involved. I personally had this happen to me. I'm a nurse practitioner by background. I've been practicing a very long time in the field of occupational medicine. And one time I had to deliver a not so accepting result for a DOT exam. And the particular patient was sitting on the exam table and actually came off the exam table after me and had me kind of cornered between the door and himself because he was not happy with the results that I just gave. So that would be a client on worker type situation. Worker on worker, usually again, colleagues, co-workers, peers, and it can be a lateral type violence with notes, emails, threats, unsolicited, again, bad behavior. Type 4 is personal relationships. Again, that could be, some issues with, we just had a recent shooting, actually where I live here in Pennsylvania at a hospital. It was a ex-boyfriend was waiting in the parking lot for his ex-girlfriend to come out of work, and it happened in the parking lot. It was an issue of violence from a relationship that spilled into the workplace, and she was killed. Lastly is not on this list, but there is a type 5 ideologic violence, and that's directed towards specifically religious beliefs, extremists, or political type affiliations. And we saw that a few years back with the storming of the Capitol. And again, those type of situations where there was violence in the workplace from an extreme perspective. Okay, so let's talk a little bit now about preventative measures and what can you do? And these are just, again, some more tools that we're going to talk about. So by design, you can start looking at your workplace, installing cameras, bulletproof windows if you work in retail, at cash registers and banks, minimizing entrances into buildings, locking windows, maybe only have one way of entering, but multiple exits to leave. Carded codes embedded into like your passes to get into buildings that help secure, and you actually know who and when they come into the building. Lighting. Make sure your exteriors, as well as your interiors for that matter, have significant lighting and it's safe to maybe walk between buildings or walk to a parking lot. You want to make sure your office furniture is positioned so that you can view passerbys. And as I mentioned, not be cornered. So the exam tables are placed in a manner that I could now easily egress from the exam room because I am placing myself now closer to the door. So think about how you place your office furniture. Would you be cornered in a situation or have a way to leave? Some administrative practices, if you're in retail, low cash on site, you want to keep valuables locked up when possible. You want to do lots of education and training, and I'm going to talk about that near the end of this presentation. And finally, you want to teach people how to respond to a situation. What do you do when it happens to you? Workplace practices, as I mentioned, performance evaluations and appraisals are a time when that's at a high, kind of a vulnerable time for an employee and their direct reports. So make sure that you're doing a fair evaluation and it's very transparent in how you're doing that. You want to make sure you use the buddy system when at all possible, whether that be traveling into a new and different area, or even traveling to a remote area, in your parking lot. As I mentioned, that nurse was leaving her place of employment on her way to her car. and happened to be caught on camera. So there was cameras there. But you want to make sure that there's also good lighting and travel and, a group if at all possible. Have a designated contact should you need it, if you need to let someone know where you're going to be and what you're going to be doing. And there's multiple phone apps that you can put on to track where you are and what you're doing. And be mindful of unsafe situations. You just do not want to put yourself in a situation that may put you at risk for a violent type situation. So some strategies for preventing it. Again, it seems like we were talking about the same things, but we're really not. What we need to do is we need to look at our workplace, and we need to look at and analyze not only what the workplace looks like, but what are our employees telling us. We need to be creative in our environment and create a supportive environment. We want to make sure that we have an open door policy, and you have an open door policy with your employees, that they can feel free to come to you and talk to you about a situation that they're not comfortable with. You want to offer communication and empathy training. There's a lot of web-based programs that you can utilize. If you do not feel comfortable doing, that training on your own, you may want to turn to some type of web-based training. As I mentioned, SHRM has a lot of great resources. You want to make sure you have a policy on workplace violence. And in that policy, you're going to talk about how it's going to be handled, disciplinary action, what are the expectations of you as the employer or organization, and what's the expectation of the person doing the reporting. You want to commit to a nonviolent workplace. You want to train your employees on the signs and symptoms and things that they can pick up on. Again, the appearances, the absenteeism, substance abuse, things of that nature. And you want to create an action plan, and you want to practice it. Some of you might remember this. This was cited as an example, and it's actually a very good example. But back in the 50s, they actually had nuclear attack drills. And, now you're seeing more and more, especially school systems after these school shootings, that they're doing active shooter simulations. Consider doing that at your place of employment. There's a lot of great resources out there. Work with your local law enforcement, and they can certainly be helpful in helping you devise a simulation plan at your facility. Again, this one was taken from NIOSH, and I'd like to have lots of resources that are free to give you, but it talks about different strategies. We just reviewed environmental and some of the administrative type things. But other things to think about from, some of those different categories that I shared. When you're looking at a customer client, potential violent situation, ways to mitigate that are to assure that you have adequate staffing, that you encourage and discuss good interpersonal communication skills, and you want to encourage your employees to engage with you and tell you about these things. And you want to be doing constant training on customer violence and how that might impact them. From a worker-on-worker perspective, there's things that you can do from a management perspective. Look at your hiring process. Here at DISA, we do background checks and reference checks and substance abuse testing. These are all really good things that, as I mentioned, substance abuse, mental health issues, things of that, pre-hire physicals, those would all be part of your hiring process and how you maintain that. So we do highly encourage that. Again, that's something that we can give you more information about from what can be done from a background perspective or a reference perspective. And the last thing in that category is talking about new hire orientation and setting the stage right from day one on what your expectations are as a company, and that you will not tolerate any type of workplace violence behavior. Lastly, from a personal perspective, creating that culture of support. So if you have resources like an EAP, that's another great resource. If there is a domestic violence situation or something that's going on in their personal life that may spill into their work life, that would be a really great resource for your employees. Okay, so we talked about the tools, we talked about what to look for, but now it's happening. How do you respond? We're going to talk about active shooters, but as we look at some of these other high-risk areas like suicidal employees, if someone verbalizes that they've given up, they have no will to live, you want to get them to HR, you want to get them to the EAP. Do not try and tackle that on your own. You want to get them to the resources that are available to them. They may not have a personal physician, so what resources you can provide, or a company physician to help guide them, or the nurse would be very helpful. If there's concern about domestic violence, you want to make sure you give them resources. As an occupational health nurse, I can tell you, I hear a lot about, from employees when I was working on the industry side of things before I was a nurse practitioner. I would be that confidant. They're going through a divorce. What should I do? I'm having issues with my son because they have a substance abuse issue. My spouse is, being physically abusive. What are my resources and options? So you may not have the tools in-house, but you can have a tool list in place on where to get these employees their help. If there's a bomb threat, we're not seeing as much of that anymore, but if there would be, obviously things, how do you respond to that? Keep them on the line as long as possible. That's like the biggest thing you can do. And if you can avoid hanging up, those ways can be traced. Again, we're not seeing that as much, but you want to make sure, is something as simple as a tweet you might have in place that you could tweet to your employees, bomb threat, evacuate the building, or put that as part of your process. And what do you do if you get a suspicious package? Certainly you do not want to touch it, handle it, open it, move it. You want to vacate the area, and you want to notify any authorities about that particular problem. So as I mentioned, in regards to active shooters, and what do you do? Running and escaping is the best possible scenario. And if you can do that, you want to make sure you can egress the building very quickly. You want to escape it, again, with your hands up. This comes from the Department of Homeland Security. You want to make sure your hands are up and visible so they know you're not carrying a weapon. Again, it's horrible to say, but we see this repeatedly on television with these school shootings and how the students are asked to leave the building with their hands up. That is the best response you can do if you're leaving very quickly. If you see wounded people, you're not expected, and nor should you try and move them. You need to get to safety, and certainly alert 911 as soon as possible. Perhaps you cannot leave. Perhaps you're in a situation where you cannot escape. You might be in one of those offices that I mentioned where you do not have a way to egress without someone seeing you. You want to actually try and get out of their view, meaning the shooter's view. That's the best possible scenario if you have to hide. And try not to trap yourself if at all possible. When I go to, say, a hotel, and I'm looking at ways, if I had to quickly leave, or, a movie theater is another good example. How do you quickly leave? Where do you sit in that theater to make you easiest to leave should something happen? Is an end row, an end seat the best? Absolutely. If you're in the middle, it's harder for you to move. But if you are in the middle, you can duck down and try and hide. So think about your scenario, think about the situation, and try and pre-think what that situation is and what you need to do to remain safe. And lastly, if you have to, and your only resort is to fight that person that is the active shooter, throwing items at them, yelling, causing commotion, and committing to being violent back to them is actually considered, kind of a last ditch effort on safety. Example that I had, a friend of mine and I, we had a good conversation about this because she's in charge of an occupational health group that is part of a large healthcare system in Florida. And we were at a conference one time, and we actually shared a room, and she brought in one of those door wedges that props open the door. And I said, what are you bringing that for? She said, I put it opposite inside my door to make sure if anyone tries to open, it'll stop that door. So constantly thinking about ways that you can prevent someone from entering. We see these cameras on our porches now with rings and what have you, but think about ways that you can stop a potential issue. So now that we talked about all these different areas, we talked about issues, we want to do an assessment of our facilities. And, there is a workplace violence facility assessment worksheet, and you can get these on the NIOSH website. There is an actual toolkit for that. And you can walk through and kind of answer these questions, yes, no, or not sure. And as you answer these questions, those would be your starting points, especially for things that you are no or not sure of, where to start. So when you start going through now and looking at your facilities, you want to look at the area, you want to look at your policies, you want to look at your training, you want to look at what your employees know, and you want to look at their surroundings. So this is a great worksheet to get you started as a baseline on doing that facility assessment. So shifting now over to OSHA. So as you look after you do your assessment, what do you need now for the program? And OSHA actually has 7 elements of what they call a evidence-based, kind of best practices work violence program, prevention program. So first and foremost, now you've done your assessment, now you want to get the full, kind of program together. So make sure that you have a well-written policy statement on what your company policy is. Obviously, I've never heard of a company that says we welcome violence, but you want to take a strong stance on it will not be tolerated. So work with your management team and say, I need a clearly written workplace violence policy. That's our starting point. And establish that threat assessment team. We're going to talk about that and who should be on there. We're going to look at conducting a hazard assessment, looking at workplace hazard controls and prevention. We already talked about that, some training. Finally is incident reporting, encouraging all incidents to be reported. And we're going to encourage record keeping. Now, as I mentioned, that first step was that workplace violence policy statement. So I, again, never heard of a company that says, we welcome it. You want to make sure that, again, the policy is well written, is very clear on the management's concern and commitment to employee safety. You want to make sure that it's accessible. So it might be located in the break room. It might be located in little flyers at different spots on bulletin boards. It's probably part of your orientation training. It's probably part of annual training. So make sure that policy is written and it's made readily available to your employees. So from a threat assessment team, and one other thing I'm going to add here is safety. That's not on this list, but safety needs to be included here. So hospital administration, if it's a healthcare situation, would be involved. Management, frontline staff, you want to get the union involved, security, finance, legal, HR. But the other thing to consider is, and I've seen this being done, there's a lot of work, as I mentioned, in healthcare and workplace violence and civility, is actually having a civility team. And the civility team, I've been somewhere recently where it was called a healthy workplace team. And what they were, it was a bunch of peers from different levels of the association or organization. And they made themselves readily available to their peers to say, and we're not going to accept this type of behavior. So it might not be something that you feel comfortable elevating to administration, but it might be something that you're comfortable elevating it up to a level of peers to help you address this issue. And then there's a whole charter and the whole thing. So think about that. But you may not want to go that route. You may want to have this team. And this team, again, is responsible for looking at vulnerability to violence. It's to work on preventative type initiatives. And they are responsible for doing those drills that I spoke about, training, and also doing regular audits to make sure everything is staying in place and intact. So as we do a hazard assessment, again, getting a little bit further into the weeds of what's been going on, is looking at your OSHA logs and your accident reports that have been filed, and look at what possibly was a result of a workplace violence or bullying situation. Has there been anything at your facility that you need to look at? What are the trends? And make sure as you're doing that and reviewing it, you're documenting this. But you can also look at meeting minutes. Perhaps it's with the union or some issue like that you need to identify a potential problem where employees are not happy, and how do you need to address it. So once you identify the trends, you want to look to other like businesses and how they've addressed it as well. That'll be helpful. And look at what trends they're seeing, whether it's certain departments, if it's, the time of day, things of that nature. That's what this hazard assessment is about. Some of these we've already mentioned too. They mentioned that ID cards are very helpful. Internal communications, you heard me mention, Twitter. Perhaps you need to have some type of an emergency situation call out on social media where everybody gets an alert. I do know some institutions will send out alerts that there is some kind of security concern with say in the parking lot, or there was a rape reported, or there was some issue where it can get out to everybody very quickly. So whether that be a text, whether that be a social media site, just have some type of internal communication that you can get it out to very quickly. Security procedures, make sure they're up to date. You want to make sure things remain confidential as much as possible so there's no fear of retaliation. Looking for and having tools available for those being involved with domestic violence. And again, that training and awareness. I mentioned background checks are very helpful, and having substance abuse programs available through EAP programs or substance abuse testing is also helpful as well. Training and education. Regardless of the level of risk, all employees need to go through this training. It's important. It may not benefit them in their workplace, perhaps. It might benefit them in a community event. It may benefit them in their personal lives. So all employees need to participate in this. The training should be easily accessible, easily understandable. It should be placed in terminology that's appropriate for all audiences. If you have, multiple different languages being spoken within your facility, you want to make sure it's available in different languages as well. And consider that pre and post test. What's their knowledge about this going into it? And then what's their knowledge about it going out of it? As simple as those 6 questions that I asked all of you at the beginning of this session. What's their understanding? You want to demonstrate that they have a higher level of understanding coming out of that training on this process. So you want to measure their level of understanding. Okay, so incident reporting, again, it really needs to be tracked internally. In most cases, needs to be tracked externally as well. And you want to, again, look at the whole situation as much as you would any other accident situation and accident investigation at your facilities. And you need to provide debriefing. You need to debrief the people involved. You need to debrief the other employees, and you need to give them good, accurate information very quickly. Again, back to that shooting that happened at a local hospital. That information was coming out on social media immediately to their staff at the hospital, as well as to the community and what they should be concerned about. If not, it creates hysteria, and it also creates the rumor mill to kind of lead down paths that are not appropriate. Record keeping, I think I went through this. Make sure you keep track of everything from what you're required to with your OSHA 300 logs, but looking at all your investigations, meeting minutes, training records, anything that you're doing in the way of testing for employees is also very helpful if you need to go back and look for any type of trends or situations going on within your facilities. Okay, so I'm looking here on my time to see how much time I have, because I did want to go through a couple scenarios and case studies. And the case studies that I want to share, and I'm sure as I went through all these slides and talked about what were some high risk situations, what situations have you heard about in the media? What have you might have heard or saw within your facilities? What might have happened to you as a family member? What might have happened to you as a community member? I think we can all sit and reflect on different scenarios that had different outcomes. And I think we can look back and say, what would we have done differently? Did we see the signs? We see that now. I watch a lot of forensic files. I do. And I look back and I see when they get to the end of the show and they tell you, these were some of the symptoms ahead of time. These were some of the characteristics ahead of time. Those are the things that we need to be mindful for. So I gave you a lot of resources. I gave you a lot of information. Some of it, sounds very basic and intuitive, but it really is not to everybody. And I have 3 quick scenarios that I want to run past you and as case studies. And again, you might all have some that you want to share and use in your facilities. First, we're going to talk about this young lady who started a new job. Started a new job as a teacher, very first time teaching. So as you can imagine, it was stressful, not sure what to do, how to get a routine and what have you. This person was in their job maybe about a month and quickly determined that there was a lack of mentorship. Even though they stated they had a mentor identified, there was a lack of mentorship. This person would go and ask that mentor for help or somebody else and would be told, you should know this, you went to school. Being told to discuss concerns with another employee, was told to do that because maybe she was not adjusting well enough and you should talk to somebody else that's been in your shoes a year ago and they'll be able to help you. She went and talked to that employee as directed, and then that employee turned around and said that this person is creating an environment of incivility because she's saying that she's not getting the support that she needs. Soon finding out that she was not being included in meetings, not being included in lunches. There was cliques in the workplace, and was even told by one of the fellow employees when she was getting to know people, I don't hate many people, but I really hate her, when she was explaining another employee. So as you hear that scenario and think about kind of what's going on internally within a school system, this is a school among teachers. This person in this scenario was actually my daughter, and it was her very first teaching job that she had. And now, as we sat back and reflected on kind of these experiences and things that she told me, she really was in a pretty hostile work environment. There was workplace incivility, there was workplace bullying, and hindsight, she left that job and she's doing well now, but that was her very first job and that was the experience that she had. So as I look back now and kind of saw those signs after she explained it to me, she was not aware of what workplace bullying and incivility was really like till she experienced it, because she had gone through that training. So that's one case study. Another case study, longtime employee, 30 plus years, he's a corporate accountant, worked at his job, showed up on time, and always worked late, doing what he was asked. Long time, well-respected employee. A newer employee to that department came in and would like that job. So this employee thought it was time that maybe if he tried to do some things at work, perhaps it would encourage this older long-term employee to maybe retire sooner because he wanted that position. So this employee, the younger employee, started going into the office of the long-term employee, moving things on his desk. Things became missing, leaving notes about maybe it's time to quit, tapping on the door as they walk by, annoying little notes and disrupting phone calls, and even said a couple of times, it's time for you to retire. Well, that particular person happened to be my father. And my dad actually went to HR about it and told him, he documented that he was being harassed for over 30 days, His boss did nothing about it. And actually, when it got reported up through the chain, because nothing was being done about addressing this harassment, the employee that was doing the harassing, as well as his direct boss, was actually terminated. And my father went on, actually, he retired at that point. He was done. But looking back, he was not aware. This was back in the early 90s, late 80s. And, he was not aware that all of these things that were happening was considered workplace harassment. So again, training would have been helpful in that situation as well. Lastly, this happened in July of 2020. I mentioned about community events and the way personal issues can kind of impact kind of the workplace. This wasn't really a workplace, but it's an example I'm going to cite. A middle-aged couple, both going through divorces, were on a date, and they went to a local popular restaurant and were having dinner, and they were leaving the restaurant. And I should back up and say the female in this couple was actually dealing with some pretty harassing comments and threats by her ex-husband, and was actually had a PFA against her husband. So he did not have any weapons in the house, was not supposed to have any weapons in the house or on his possession. Well, anyway, this couple was leaving, this couple that was dating was leaving the restaurant, and from up in back of the parking lot up drove a truck. Out of the truck came an individual who happened to be the woman's soon-to-be ex-husband. He had a ghost gun, so he did not have an actual legal gun, but it was a ghost gun. Shot them both multiple times. They were dead on the scene. This particular example happens to be, was my cousin. So the reason I'm sharing these is I had 3 incidents just that I'm aware of in my immediate family. Think of the things that are going on in your family and what you're hearing. Think of what's going on with your employees and what you can do to help. Know the warning signs, be educated, provide others with tools and ways of staying safe. And I'm sure you're all sitting and listening and thinking, oh my gosh, all of this happened, just in your family. And it actually, they're real life scenarios. And I want you all to take time to reflect on scenarios as well. And again, what can you do differently? How can you prevent them? And what can be done to mitigate workplace violence, violence in general, community violence, active shooters? We all play a part in that. So this concludes my presentation. I do think we have a little bit of time, Thomas. If you would like to come back on for some questions, I'd be happy to entertain any questions.
Awesome. Well, great presentation, and appreciate you taking the time to be with us today. Kim, we don't have a lot of time, but let's see if we can speed run through a couple quick questions. First, who should lead workplace violence initiatives at my company?
I gave a list of, HR, safety, employees, unions. I think those should be the key people that address this, but most importantly, getting the employees themselves involved, that there's a peer-to-peer contact as well. So it needs to be driven from the top down. And again, consider some type of employee-based committee that employees can feel comfortable reporting to.
Gotcha. I know you mentioned NIOSH a lot, but we have a question here. Which websites do you find the most helpful for workplace violence?
Well, I always say the best one is the one you're going to use. NIOSH has some really easy tools to implement. So does the SHRM website, the Society on Human Resource Management. And NIOSH is using that as an initiative, or the CDC has a nice one as well, accompanied with NIOSH. But they are the ones I relied on most heavily and recommend.
Great. And again, to the audience, if we didn't get to your question today, I know we're tight on time here. Don't worry, we'll be reaching back out to you. We'll be touching base with Kim to get answers to all those questions and circling back with everyone in the next week or so. Last question, Kim. In hindsight, what would you recommend the individuals from your case studies do differently?
As I mentioned, I think training is huge. I think had they known more about symptoms to look for and signs, I think it would have, helped for sure, help them identify that these are wrong and should not be happening. So I think it goes back to saying training and education is key for everybody at all levels to make sure they can identify these problems.
Gotcha. Yeah, this is certainly an event that you hope you never come across, but if you do, and you've gone through that kind of training, it'll be potentially life-saving. So
absolutely.
Well, Kim, thank you so much for your time today. Thank you to all of our attendees for joining us as well. We hope to see you in some more sessions throughout the week, and have a great day.